Homeostasis refers to stability, balance, or equilibrium within a cell or body and the ability for an organism to keep a constant internal environment. Homeostasis is maintained by many key body systems, including the circulatory and respiratory systems, but is mainly controlled by the endocrine system and the hormones produced, which regulate the activity of body cells. The body responds to stimulus with one or two feedback systems. One is positive feedback and the other is negative feedback. Positive feedback works to enhance the effect of a stimulus, such as a specific hormone being secreted or regulation of temperature that results in the disruption of homeostasis. Negative feedback, however, works to treat the original stimulus and return the body to homeostasis. Many diseases cause disruption in homeostasis in either a positive feedback or negative feedback. Graves' disease is a common autoimmune disease that is one of the leading causes of hypothyroidism and thyrotoxicosis in Australia. First discovered by English physician Caleb Parry in 1786, it is more commonly known for its discovery by Irish physician Robert Graves in 1835. Graves' disease is when the body is unable to stop the production of thyrotropin-releasing hormone by the hypothalamus, resulting in extreme levels of triiodothyronine and thyroxine levels in the body. This is commonly referred to as hypothyroidism. Affecting approximately 1 in 100 of the adult Australian population, Graves' disease is considered the leading cause of thyrotoxicosis in Australia and other parts of the world. Graves' disease itself is not inherently fatal. However, many of the side effects can result in permanent damage or death. Normal thyroid function is referred to as euthyroidism and is a negative feedback system, where the original stimulus is suppressed by the body's response. The negative feedback loop for normal thyroid function is commonly seen as follows. When low levels of triiodothyronine, T3, and thyroxine, T4, hormone are detected in the body, a signal is sent to the hypothalamus to release thyrotropin-releasing hormone, TRH. The TRH stimulates the anterior pituitary gland to release thyroid-stimulating hormone, TSH, which causes the thyroid to release appropriate levels of T3 and T4. The thyroid then tells the hypothalamus to stop secreting TRH, returning the body to homeostasis. However, with Graves' disease, instead of a negative feedback loop being formed, a positive feedback is created, resulting in a large disruption in homeostasis. With Graves' disease, the body still detects low levels of T3 and T4 and compensates for that by telling the hypothalamus to release TRH and the anterior pituitary to release TSH, resulting in the release of T3 and T4 by the thyroid. However, once the thyroid gland receives the TSH from the pituitary gland, TSH antibodies, also known as TSABs, link up with the receptors, causing the communication between the thyroid gland and the hypothalamus to stop. When this communication stops, the hypothalamus doesn't know when to stop secreting TRH, resulting in the thyroid gland releasing excess levels of T3 and T4, disrupting homeostasis. The excess levels of T3 and T4 can cause many symptoms to occur within the body, which are closely associated with Graves' disease. These can include brittle hair, changes in menstrual pattern, enlarged thyroid gland, also known as goiter, an increase in appetite, muscle weakness, excessive perspiration, muscle tremors, arrhythmia, fatigue and difficulty sleeping, increased sensitivity to heat, nervousness, anxiety and irritability, sudden weight loss and increased metabolic function, thinning of skin, tachycardia, and Graves' ophthalmology. Treatments past, present and future. Hypothyroidism, despite being officially discovered in 1786, can be traced as far back as 2700 BC China, where a common treatment for a goiter or enlarged thyroid gland, as described by Emperor Shen Nung, was the application or ingestion of seaweed, which was believed to have provided aid due to the large amounts of natural iodine it contained. Moving on to 961 AD, Abul Qasim first described the use of a needle biopsy and thyroidectomy for the treatment of goiters, which is very similar to current radical treatments. In the present day, there are many highly effective treatments for Graves' disease, hypothyroidism, and thyrotoxicosis that are not too dissimilar to past treatments. Radioactive iodine therapy. Radioactive iodine therapy involves the ingestion of a radioactive iodine that destroys overactive cells within the thyroid gland. This treatment also causes the thyroid to shrink, lessening the symptoms of a goiter. The side effects of this treatment include Graves' ophthalmology, neck tenderness, and a temporary increase in thyroid hormones. However, with this treatment, thyroid hormones are permanently needed after and can cause their own side effects and complications. Antithyroid medications. The purpose of antithyroid medications is to interfere with the thyroid's use of iodine to produce hormones. It is a common treatment, however, due to the risk of relapse if used by itself. The treatment is usually used in conjunction with radioactive iodine therapy. Side effects include rash, joint pain, liver failure, and a decrease in white cell blood count. Beta blockers are different to antithyroid medications due to the fact that instead of stopping the production of hormones, they just inhibit the body's function to use the hormones to their full extent, blocking the effect they would have on the body. There are many beta blockers that can be used to treat hypothyroidism, and each one is different to the next. Despite their effective and fast nature, beta blockers have a high possibility of increasing existing symptoms of Graves' disease. Surgical treatment intervention. Despite being the most effective treatment, surgical intervention is only used in the most extreme cases of hypothyroidism due to its radical nature. The most common surgical treatment is either a total or subtotal thyroidectomy, or the removal of whole or part of the thyroid gland. This treatment is used as a radical last resort treatment and can have many very serious complications, including damage to the laryngeal nerve that controls vocal cord function, damage to the parathyroid gland, which produces the hormone that controls calcium levels in the blood. Despite all current treatment methods being highly effective, new treatments are always being discovered for many different diseases. In the case of hypothyroidism, there are not many clinical trials currently on offer for new treatments. However, scientists have proposed to use both gene therapy and the use of selenium to treat Graves' disease. The selenium treatment has yet to be tested, although there has been a trial proposed in Europe to be offered to sufferers of Graves' disease and hypothyroidism.